So, today, we're going to do a microneedling procedure. So, once we've carefully applied the anesthetic cream and thoroughly cleaned the skin, we can proceed with the next steps, which I'll be showing you in detail. Of course, today, we're going to do microneedling with PRP, which is something that can be done effectively. With PRP, unfortunately, we won't be using the anesthetic cream, as the two substances can't interact with each other. However, with regular microneedling, we can apply an anesthetic cream. It's up to the client to decide. It's not compulsory, rather, it's an option we can offer the customer. So, for instance, if we were to put the anesthetic cream on, we would clean the face first. Then, afterwards, we would proceed with the disinfection. On the other hand, if we perform microneedling with PRP, we would move directly to disinfection, just like we're doing now. Disinfection can be carried out using alcohol swabs, chlorhexidine swabs, or any other disinfectant designed specifically for the skin. We're going to cover the entire face. Since the alcohol has soaked into the cotton pad a bit, I won't begin with the forehead. Instead, I'll start with the lower part of the face. Considering that the client had PRP injected around the eyes, I'll make an effort to avoid this area. We'll carry out a second disinfection using a second cotton pad. So, the benefit of using microneedling is that it will enable the skin to better regenerate its collagen. Microneedling induces collagen production. The addition of PRP significantly enhances the treatment. So, PRP on its own gives a very nice result. It effectively boosts collagen. And microneedling on its own as well, but the two combined will produce an effect that's significantly better, therefore much more satisfying for the customer, and a result that's also notably quicker. A microneedling treatment typically involves one treatment each month, usually about 4 to 6 treatments in total. However, if you combine it with PRP, you can achieve great results with just 3 treatments. So, microneedling comes with a sleeve that's like this here. We're going to protect the device. So, we're going to tuck it inside, like this. We'll remove the paper. And on the tip, we've got a kind of little sticker to close the whole thing up. We'll make sure it's closed properly. Next, we'll carefully open the needle here, which is individually wrapped and sterile. We'll make sure to open it delicately so that it doesn't fall onto the ground. We will take it from the side, never from the top where the needles are located. Otherwise, there's a risk you'll prick yourself. And then we install it on the device. So, if you come closer, right now, a mistake I made, I didn't hesitate to show you, right now, my needle is at 2 mm in. The needles come out on top. So, if I'd been to put the needle in like that, there would have been a risk of me pricking myself. Ideally, when you put a needle on the tip, try all the time to have your tip at 0. There's less risk of you pricking yourself like that. Given that we're planning to use PRP and that we have a limited amount, it's not like a serum, I'm going to focus on the areas that customers want to work on the most. So, for instance, if it's where the customer wants to concentrate more on fine lines, I'll target the fine lines first. If there are additional spots, the extra spots, if it's more pores, we would come and target the pores. Whereas with regular microneedling with a serum, I could cover all the areas, and it wouldn't be a problem at all. But since we have a limited amount here, I'm going to target what I want to work on first. So to begin with, I'm going to apply a small amount of PRP or serum to the area we're going to work on. Just like that. And I might need to add more throughout the treatment if I notice that the product is drying on the skin. I'll keep one finger to spread the serum or PRP. I'll use the same finger for the rest of the treatment. On the cheeks, the skin is usually a little thicker, so we'll go to 1 millimeter and see how the skin reacts. I'll make sure to maintain a consistent pressure as I spread the serum. Additionally, I'll be paying close attention to any changes in the skin's texture and color. We can notice a slight redness at the area where you've been, but I think I could go a bit deeper. So, I'm going to increase my depth slightly and then I'm going to observe the reaction once more. If we take a look at the skin's reaction, we can observe that where we've gone, where we'd increased the depth, it's a little redder, and that's exactly what we want. So, we're going to maintain this depth for the remainder of the treatment on the area we're going to treat, and then we can apply the same depth on the other side. If we hadn't seen any redness again, we would have increased. Additionally, on the contrary, if we had experienced a lot of redness with minimal bleeding, then we would have gone back down. So, essentially, this is the process we use to calibrate the depth we plan to go, based on the reaction observed on the skin. Therefore, our goal is simply to induce inflammation on the skin to stimulate the skin's scatulage factor. At this moment, I feel that the skin has absorbed quite a lot of product. We'll just add a little bit more. So, with the PRP, you need to be very cautious. Sometimes, it can gather like a small clot on top, right on the tip of the needle. In that situation, we'll have to apply a bit more pressure. It could get everywhere. So, you really need to be extremely careful when using the PRP to weigh very lightly. So, as you can see, I'm currently using another technique. So, the technique that I've employed is somewhat of a sandblasting effect with the microneedling. There are numerous ways to use a microneedling, but there's really no wrong way. As long as you respect the application speed and the direction as well. So, I'm never going to microneedle at an angle like this here. Otherwise, you're going to make oblique perforations that can injure the skin. You always stay perpendicular to the skin. I could have done VA tie-in like this here. Sanding effect. And I could also perform a stamping effect as well. So, we will primarily keep the stamping effect for areas that we want to treat more thoroughly. For example, a pigmentation spot or deeper fine lines, this is where we can use a stenting effect to address those concerns more effectively in this particular section. So, with the PRP, I'll work section by section because the product dries much faster than a serum. While with a serum I could have done half the forehead completely and then done the whole unfinished area during my 3 passes. So, as before, I'm going to make a mask with the PRP. One question I often get is, as an esthetician, can I use PRP? The answer is yes, but it has to be a nurse, an auxiliary nurse, or someone who works in the health sector who takes the blood sample and puts it in the centrifuge machine. The nurse can give you the syringe like this here, and then you can do the PRP with it. However, under no circumstances is a beautician permitted to draw blood for the PRP. So, microneedling or PRP can also be performed on various areas of the body. For instance, we could treat stretch marks, old scars, such as those on the udder and the small cesarean section scars. We could definitely work on those. Of course, when dealing with a scar, you must wait at least 6 months after surgery and up to a year. It's really important to wait until the skin has completely closed up and fully healed before starting any treatment on it. If you're working on a scar that is more recent, estheticians are not permitted. It will be dermatologists and doctors who will be able to handle it. Regarding the body, we will still disinfect the area. I am going to disinfect up to twice the entire area we will be working on around the scar. So, yes, you can work on scars, but you have to be extremely careful. Is the scar bulging? Is the scar inflamed? So, you really have to be cautious. Hypertrophic scars and keloid scars are not to be touched at all. If you see a bulging scar, you must refuse. Otherwise, if you perform the microneedling over it, it could potentially aggravate the hypertrophy of the scar. Only doctors are qualified and able to work on these specific types of scars. So, a scar or stretch mark on the body is going to be worked on a little differently than on the face. We're going to do a little more intense work on the skin. I'm going to apply the product. Since it's PRP, I'm going to go from small section to small section because I want to have enough left over for the whole scar. In terms of depth, we're going to work on it to at least 2 millimeters. So, 2 millimeters is the maximum that the doctor's bonding allows estheticians to go. So we will start the treatment. My movements, when I press on the body, are a bit quicker. This is because I really want to create inflammation on the body. Since on the face, it's more uncomfortable, we try to move a little faster. Now that we have the redness we're aiming for here, I won't proceed any further in this area. I'll move on to a different area. We've got a little bit of plasma serum left. We will just give it a gentle and light coating. So, once we've completed microneedling, it's really important to dispose of things correctly. So, the needle should go into the biorisk container. The microneedling needle, we're going to take it from underneath like this. Then, we'll unscrew it, and throw it into the biorisk. So, what is the treatment after microneedling? After microneedling, it's really important not to put anything on the face for that entire day. So, when the client leaves the clinic, she will leave with only the serum that we've applied to her face. No moisturizer or sunscreen will be applied on the same day at all. On the evening of the treatment, the client can rinse her face if she feels the need, if she is feeling discomfort, but no cleanser. As of the following morning, the client can resume using her water cleanser, can apply a moisturizing cream, and can also put on a sunscreen. At least 48 hours after treatment, no heat is applied, so no shower, no hot bath. And 72 hours after treatment, no spa, no swimming pool, and no sport or sauna. Why not? Because we've created openings in the skin, and we want to prevent any bacteria from entering. For at least 5 to 7 days, no makeup. No irritating ingredients either, so all the active ingredients, so the AHA, BHA, retinol, and no exfoliation either. So, we're going to avoid all that for at least 5 to 10 days. Then, regarding sun exposure, as much as possible. So, ideally, we will wait about 1 or 2 weeks after the treatment to avoid any prolonged exposure to the sun. So, that was how to do a microneedling treatment.